Welcome to the Clear Health Quality Institute webinar on telemedicine accreditation as a catalyst for improving clinical, operational, and patient outcomes. Before we begin here, we have a few housekeeping items to deliver. This is the first of 3 webinars CHQI has planned for this year. Information regarding the 2 upcoming sessions is available on the CHQI website. The webinar will be recorded, and a link to the recording will be emailed to all registrants within a few days. Handouts are available for download, including today's presentation and an executive summary of the standards. And the download for handouts is just below the attendee list on the right part of your screen. Attendee microphones will be muted, but we will encourage participants to submit questions during the presentation via the chat window in the GoToWebinar platform. These questions will be addressed at the end of the presentations, time permitting. Next slide, please. First, I would like to introduce our panel for today's presentation. I'm Rich Baclar, your moderator, Vice President and Chief Strategy Officer at VitalNet. I was past president and current fellow of the ATA and a member of the CHQI Advisory Board of Directors. Our distinguished panel includes Till Jolly, Chief Medical Officer at SOC Telemed, Bill Lewis, Principal at Well Medcare, and also the co-chair of the CHQI Telemedicine Standards Committee. Kevin Smith, Chief Medical Information Officer at Hypnosis, and Emily Wine, Esquire, attorney, and Baker Donaldson, shareholder. Before I begin, I would like to provide a bit of context of why we're here today. In 2018, this marks the 50th anniversary of the proof of concept demonstration in Boston when Dr. Ken Bird introduced the term telemedicine and connected the medical clinic at Logan Airport to Mass General Hospital using TV cameras and line-of-sight telecommunications. Technologically, we have come a long way and have enhanced software computing power, internet collaboration, and digital mobile devices. Alternate payment models for telehealth reimbursement and recent government parity laws favoring connected care have incentivized the use of telemedicine. Finally, payers, providers, and consumers are accepting telemedicine and driving its adoption. Therefore, the time is right. Maturity of the industry and the stakeholders' need for practice guidelines and government standards are critical to the safe and effective use of telemedicine as a scalable and for routine clinical delivery models. ATA has taken the lead on developing clinical practice guidelines and telehealth education. CHQI has now been endorsed by the ATA to perform telemedicine accreditation to ensure independence for provider compliance with community standards to enhance patient safety and quality assurance. Please go back one slide. Today's agenda includes a brief history of telemedicine accreditation, the CHQI process for standards development, some benefits for telemedicine accreditation, and the enrollment and applications overview. Let's begin with a brief history of how we got here by Dr. Till Jolly.
Thank you, Rich. And what I'm going to do is go over a bit of the history, as you see, of telemedicine accreditation specific to the CHQI initiative in collaboration with the ATA. As many of you know, in 2015, the ATA endeavored to begin an accreditation program for online patient consultations, some part of which is commonly called direct-to-consumer consultations. And this achieved some wide utilization, but over time, there was a realization that the telemedicine community and the telehealth community is really broader than that. It includes multiple types of telemedicine delivered across multiple platforms and to multiple stakeholders. And so with that in consideration, a process began to include a strategic partnership with the Clear Health Quality Institute, CHQI, to begin to manage the day-to-day operations of the program and to really make it a more formal program. And this is really a third-party process to bring a level of integrity, although it was a quite rigorous process, but to really bring some standardization and to allow for some growth of the program. Next slide, please. So as this began to grow, there became a realization that it's really more than just that element of the telemedicine community, that really the the consumer to provider and provider to consumer markets really need some standardization. So a volunteer group of subject matter experts came together to begin to work with the initial standards and make them into broader telemedicine standards based on a set of known best practices. Now other bodies have been involved in quite a strong way and quite a constructive way in telemedicine accreditation over time. This effort really looked at standardizing things across a telemedicine specific platform and really using best practices that are also known across the accreditation industry in general. This past March, CHQI proudly launched the accreditation program version 2.0 that really is now available publicly as a set of standards that all telemedicine delivery groups and modalities can use to really define a set of best practices. Next slide, please. The ATA is very proud to have CHQI as its only recognized body for accreditation, and accreditation has a number of uses, is a well-known concept in the healthcare industry, and has really been helped to create a set of standards and bring everyone up to a set of standards that patients, consumers, payers, providers, and others recognize as what truly define a strong healthcare delivery organization. This is true of the CHQI initiative and is really a set of growing goals and standards for the organization. Next slide. Now, CHQI specifically was founded by Gary Carneal, who previously served as CEO of URAC, which is also a well-known organization in the accreditation industry, and really over time with other organizations brought a set of growth and standards to the industry that previously had not existed. He's also worked in a number of other accreditation programs. And CHQI is designed, and this partnership with ATA is designed to be able to scale and adapt. Telemedicine is rapidly growing and changing. As you heard, telemedicine is not a particularly new concept, but the industry is growing and changing both for clinical service delivery and for business growth. And those models really need to adapt to really ensure patient quality and patient care quality, and that is the overall goal of the accreditation program. Next slide. So CHQI really operates as a third-party accreditor in the realm of ATA bodies, but also works within other accreditation standards in other parts of industry. It was founded last spring, but really brings with it a large set of experience in a volunteer-based governance system. So volunteers who come together to create a set of national standards that will evolve and grow over time. The real focus is on value-based care delivery models that really focus on clinical quality and bringing the best practices to the industry. Now, I'm going to turn it over to Bill Lewis. You're going to have the next slide.
First off, I want to say thanks to everyone for participating in this. This is a great endeavor, and I think you're enlightened in understanding the importance of accreditation throughout the nation. And this is the first process that's going forward that has credibility in terms of its fidelity and taking telemedicine to the next stage. So again, kudos to you guys for recognizing the importance of accreditation. Next slide. So the standards committee was formed with a lot of work and a lot of due diligence. And I think it's real important to note who's on the standards committee and who is involved in this process. First off, we wanted to have stakeholders that represented the cross-section of the industry. So we do have attorneys and legal and regulatory involved, as you can see, with Alexis, who is a co-chair, and Emily, who's with the Baker Donaldson, and who is a speaker later on in this conference, in this call. We also have representatives from health plans, as you can see, from Blue Cross. Myself being the lead clinical consultant for Humana. We also have representatives from the healthcare systems, such as Avera and Mercy, among others. And then we had representatives from TM vendor platforms, Specialists on Call, Hypnosis, and Aligned Healthcare. So the group is, I think, an astonishingly talented group that knows telemedicine backwards and forwards, many, many years of deep dives and product development and clinical content within this group. So we work diligently over probably a 6-month period, starting with the standards that were developed initially, which were more limited in scope for direct-to-consumer urgent care with the ATA, which were also very finely vetted. But as Till mentioned, the purpose of this group of standards committee development was to expand the scope to cover all types of telemedicine. Next slide. So this is the core framework. We're going to go into more detail on this as we go forward. But the accreditation is set up such that there are core standards on the left, which everyone who applies must adhere to. And we'll go through a little more detail of what's within those core standards. Then we broke out the modules that you apply for. That's in addition to the core, as C2P, consumer to provider, P2C, provider to consumer, P2P, provider to provider, and then we'll talk a little bit about future modules. But if you think about the reason we did this is we're looking at matching what the service line workflows were, and being a service line being, say, dermatology versus a service line being telestroke versus a service line being a orthopedist covering his own practice, and matching the service line, the workflow, the staffing, with the equipment needed to perform those functions. And I think you'll see as we discuss this that any type of telemedicine can fit into those 3 buckets. So what the process is, you apply for your core, then you pick, and with the help of the staff, which additional module you fall into, or maybe 2. Maybe if you have multiple service lines, you may have 2 that fall into P2C and 1 that falls into C2P. In terms of future modules, which we will be reaching out, and I'm sure we'll reach out to some of you folks, the question has already come up is, do we want specific gold merit badges for service lines that maybe are nationally utilized, heavily utilized, like telebehavioral health? We may want an international module, which has a different, very different requirement, would have some different requirements, not all, especially in terms of legal and regulatory and the scope of practice within those jurisdictions. Next slide. So again, the focus being on the modules that they service every type or range of specialty care within each module, and there's key focused delivery areas within the modules. So for consumer to provider, the key point is that that's provider consumer initiated. So those were the original standards set up by the ATA and are set up to protect were initially set up considering the fact that the public was reaching out to a clinical entity and they didn't even know who they were. Who was protecting the public from the group that they were reaching out to in terms of quality, credentialing, et cetera, et cetera. So again, it's a blind reach out by the consumer. And so there's different standards and there's different platforms, a distinct type of platform that's used for that that's different than a consultation type platform. Module number 2 is the provider to consumer, where that's provider initiated and usually an established patient. So again, the billing aspects may be very different. There can be facilitated exams because they may be a provider overseeing his or own patients in a different facility or a different type of facility, his own facility, or reaching out to a different type of facility. So that's a provider to consumer, provider controlled. And then there's a more typical provider to provider, which is a consultation type scenario where there's a minimum of 2 providers. Of course, there's always a patient in the middle of that mix. And that's a typical hospital, telestroke, teleneuro, provider to provider consultation. Again, you can visualize that there'd be a very different workflow in that scenario than a C2P and a P2C. And the standards are written to adjust and accommodate the different workflows and to evaluate them and make sure that the quality is there. Next slide. So the key components to the core standards, these are bulleted not as the standards, but these are, what we did is we took out some of the key components just so, and I think they're self-evident, so I don't think anything here is going to be shocking. But first off, we want to make sure that anything that we're presenting to the public has the legal authority to operate and transact business. And so that's state, federal, regulatory issues that we're going to validate for you, which probably the majority of applicants will have attained counsel and comply with the regulatory standards, including corporate practice of medicine, et cetera. But again, for the accreditation process, it needs to be validated. Organizational capacity and resources, we felt like it was necessary to validate that whatever's being advertised or marketing or that a telemedicine company or entity or healthcare system is trying to achieve, they have the capacity and resources to do that in terms of staffing, their hours of coverage, and the financial resources to be able to accomplish what they say they're going to accomplish in a clean and clear and professional way. Provider qualifications, I think, are a little bit self-evident. We do a credentialing oversight with credentialing review. We pull files in a separate part of the process, random files, to make sure that you are abiding by the credentialing rules that you set out. And of course, we have the minimum standards that we all know nationally to be, you know, the NPDB queries, OIG, background checks, and so on and so forth. In addition, we want to see that you have the proper people with the proper qualifications overseeing your program. So we may refer to a chief medical officer, CIO. Most organizations aren't big enough for that. Some are. But if you have someone in those roles that has the proper qualifications to oversee and manage the program, and that's the key, whether you're a 10-person or 10 clinic, 10 medical provider operation, or whether you've got 3,000, you need somebody that has the proper qualifications to oversee the program. Clinical service delivery and related modules, that goes down to the core of the workflow and the processes. How do you have your wireframe established? What is the clinical workflow, the handoffs? How do you do triage? Do you need triage? And this will be very specific per service line, and walking through from the patient sign in to the sign out to discharge, referral, et cetera. So the quality there and the ability to follow through on your workflow is critical. Medical records, I think we're all familiar with that in terms of privacy, security, and confidentiality, being able to document what is appropriately documentable, and maintain a clinical medical record. Standards of care and continuity of care. You know, one of the issues with telemedicine, it can be that it's disengaged from the traditional care or for the overall model of care. So I think we all know we're pushing towards integrating fully telemedicine into care so that it's a continuous care stream. We want to see that the referrals can be made, that the medical records can be exported and connected and provided to the entities that need them to be able to provide holistic care to the patient. Finally, or second to last, patient safety. Risk management is critical with consent, equipment quality control issues will inform consent, patient consent instructions. We would also verify that. Quality assurance and improvement, it's the capstone of all this. Do you have a program in place overseeing all components of your telemedicine system? Do you review things on an annual basis, set standards? Can you collect data to monitor and problem solve when there's issues identified in a normal continuous quality improvement cycle? Next slide. So I wanted to put up some use cases for folks to take a look at, and as examples of the different buckets we have. And as you can see, we probably don't have everything here. We were reminded recently that we didn't have telepathology, I think it was, or some others. But I think this is exemplary of the different modules and what service types would fall into these modules and some of the key characteristics. And I think we discussed this a little bit earlier. The common originating sites are something to also look at, because the originating site may well dictate which module you're provided in. Although some of these originating sites, of course, can cross-pollinate the different modules. So thank you. And again, if there's any questions going forward, then we will entertain those at the end. Next slide. And our speaker next is...
Hi, thanks, Bill. This is Kevin.
I'm sorry.
All right.
Kevin Smith from Hypnosis. Right. Kevin, you're on.
Appreciate the handoff. And I get the fun section here, why telemedicine accreditation. So I'm going to talk about the benefits of telemedicine accreditation. And you're getting a 10 reasons list. I guarantee it won't be as entertaining as a late night TV top 10 list, but hopefully it will be informative for you. So let's just go through these 10 reasons here. And there is some crossover between these, and you'll also note that this list that I'm providing here maps nicely to the core standards and that documentation that we have shared with you on this webinar. So starting out with standardization. So obviously standardization in telehealth delivery is important, and these standard processes really improve efficiency throughout any of your programs. Professional oversight is something that is provided through this process. So focusing on best practices for credentialing, for example, privileging processes, patient and provider identity verification is part of this process as well. And the professional oversight also addresses the roles of those working in the telemedicine program and the education and training processes that are used for the personnel, how those processes are maintained and updated, and really so that you're having that professional oversight on all of those components that make up your telehealth, telemedicine, or virtual care program. The next point here, risk management. Obviously, this is important, and this process really helps to identify any gaps that you might have in risk management, verifying compliance with various federal, state laws and regulations, and as you all know that is a work in progress, and there are things that are changing both on the state and federal level, if not weekly, almost monthly. And then focusing on patient safety, and this relates to the facilities, the PHI, privacy and security programs, and how you deal with emergency management for your patients in whatever setting you're providing your services. The next topic here, workflow management. So this accreditation process really essentially forces you to focus on evaluating what you're doing with your workflows. And there are several concepts here in this bullet point here, but some examples I'll focus on are, for example, your clinical policies and procedures. How are you gathering your patient history? Is that comprehensive for the services that you're providing? Patient triage processes. How are you getting those patients to the most appropriate level of care if they need some additional care, either for their current complaint or situation, or follow-up care down the road? E-prescribing processes. How are you integrating quality assurance practices into your day-to-day operations? And again, that's something that needs to be baked in. It's not something that you think about after the fact. And then also, as Bill alluded to, there certainly will be unique workflows based on the service lines that you're offering through your program. And so it's a chance to look at the different workflows as they relate to those service lines. So next slide, please. Okay, so the seal of approval. So going through the accreditation process really is something that demonstrates your commitment to quality within your program. And this is something that is not only important for the consumers, for those who are receiving services via your telemedicine virtual care service line, but also partners that are working with you. It's really showing that you are committed to having a quality program. Consumer-centric. Obviously, you're all aware of the consumerization of healthcare. Patients have become consumers over the last 5 to 10 years, and it's a very real thing. Our patients are really expecting to have services through telemedicine, virtual care, any of their healthcare experiences that are equal to experiences that they receive elsewhere. And I think we have some progress that needs to be made there, but I think we're moving along. So focusing on what is the user experience for this individual, what kind of service and support is being offered, how is confidentiality being addressed, all those things that are important to consumers as they engage into receiving your services. Efficiency. This accreditation process obviously really forces your hand to look at all of the processes for the delivery and helps you to streamline those and improve those processes that you have developed. And innovation. Along these lines, again, we're even though in the opening comments, telemedicine has been around a long time, there is still a lot of innovation that is going on in this space, and going through this accreditation process will again force your hand to look at your processes and hopefully even come up with ways that you can provide some innovation to improve the services, the experience for both the patient and the provider. All right, next slide, please. And next, transparency. So the accreditation process obviously has these very clear benchmarks and a roadmap for your telemedicine program. And again, as in all healthcare and medical practice, we want to reduce variability. And this transparency and this process really helps to have that standardization in place. And we all need to be on the same page, whether we're on the service provider side or the patient side. And going through the accreditation process also really puts a focus on best practices and evidence-based clinical care. And again, going through this process really shines a light on the best practices and helps to ensure the quality of care that you're delivering. In my own personal experience in working on telemedicine and virtual care quality improvement programs with health systems, they will often take those learnings and apply those to other services in the brick and mortar and face-to-face care. And again, telemedicine, it's a mode of providing care, and it doesn't have a different standard of medical care. It should have a standard that is the same, certainly. And so these best practices, it's really important that that is part of your program. Again, as mentioned before, we will have time for questions at the end, and I'm going to hand it off here to Emily Wine.
Thanks, Kevin. So hopefully, I think what I've heard, you have a good picture as to the substance and what will be reviewed, what we're looking for, what we're hoping to see demonstrated by within the modules and the standards within the process. And now I think I'll just do a little bit of logistics, talking about the actual process. Next slide, please. So right now, CHQI is limiting this program and eligibility for the program and accreditation to organizations within the United States. The beauty of telemedicine, obviously, is there are very limited limits to it. And so naturally, international programs and servicing international patients, whether or not the provider is based internationally or serving those patients across the seas, is a very logical next step. It's going on now, as you all, as those on the phone in this industry are very well aware. So that is something that the CHQI is going to be looking into as a next phase. But for now, just the offerings, the modules, providers based in the United States, stateside, are going to be eligible for enrollment. And those initial eligibility for enrollment criteria are very broad, and then we'll be paring them down as we determine eligibility for actual accreditation. So you have your initial licenses, and if you're engaged in the very broad description of utilizing the various types of technology to provide remote services. Next slide. This is not an exhaustive list of those types of entities, providers that can apply. This is sort of our bigger buckets of potential applicants. So whether or not you're listed here or not, if you feel like your organization still meets, still operates with one of the case uses, the modules that we described, they're in the standards, then please apply. As I'll talk about in just a second, there will be some screening to the extent that the organization does not feel that you meet the standards. But again, this is not an exhaustive list, and you should go ahead. There's a lot of assistance from the institute, from the organization, to help you navigate through that process to even see if you should start the process. Next slide. So the key steps in the application process are going to likely seem familiar, particularly those who are already providers and already subject to some sort of accreditation licensure schematic. Of course, you're going to have your initial registration. You can do that online, and we'll have the website. The Institute's going to ask that you enter into an agreement. The agreement generally states that you understand the process, you understand the goal of the process, the end product, that this is a collaborative process. You're going to have to freely exchange information, be cooperative. You are your best advocate, so the CHQI is going to be relying on you to demonstrate your best practices, as we've heard through today. So that information is going to be coming from you, and needing your cooperation, is going to be key, if not ultimate, for the determination of your accreditation outcome and for doing this quickly, making it efficient. So very much is a collaborative process. There is a fee involved that would be required to be paid. This, like I said, is done online. And again, similar to many licensure, certification, payer enrollment type processes, there's going to be initial desktop review. So all the information that you have so kindly shared will be reviewed by our accreditors, by our reviewers, at their offices, not on site at your location. And there will be a time for discussion, questions, clarifications. We understand, and I think the speakers went into this a little bit more. We understand that we decided upon some standards that we would expect to see throughout providers in this industry, but we also understand that not one size fits all. First of all, there are different shapes and sizes of all the providers, different modules, different offerings. So this is a chance in this feedback follow-up, you can really put color to the documents, the information you provide, and really talk through it. It may be that the accreditors, the reviewers, do not think they can make a thorough determination on information itself, and that a demonstration would be needed. Typically demonstration will be needed for all applications, but whether or not that review can be done remotely, that demonstration can be done remotely, is something that both parties will have to consider. It may be that for Security, privacy considerations that a remote demo is not feasible, and therefore we may need to have, the accreditors may need to go on site to see the demonstration of the service, of the offering. The whole decision, so once you have accreditation decision, you have every 2 years. The process from start to finish, I think, is expected to be around 2 or 3 months. Now, I talked about the collaborative process. The more we can rely on the applicant to share information, and not only share information, but make sure that the reviewers know what it is. You know, sending in a bunch of policies when we're responding to requests for such policies, of course, is what we're asking for, but we really want to understand which policy is which, not just something that's unorganized. Making it easy. You think of it as in any accreditation process. Those are very wise suggestions for making it through painlessly. As an example, there may be smaller startup companies. You may not have all of your policies or processes in place. Perhaps policies and processes that address one-off situations just haven't occurred yet. So either your policy is scant or maybe it hasn't been developed yet. Those are things that you can work with the Institute on, understanding how to fit your situation. You're not an established provider. You're figuring this out. You're in the new stages. These are things that you can work with your reviewer to determine what standards, what information, what documentation is required really will apply to you. I mentioned the portal. I want to make sure I mention that. Okay, so, and also, I should mention, as a healthcare regulatory attorney, all the online back and forth is going to be secure and HIPAA compliant. I mean, I think that probably should go without saying, considering we're a telehealth accreditation organization, but I just felt that I should. And again, the decision whether or not a demonstration, an online demonstration for your offering and your service line, whether that can be done remotely or not. I mentioned it may not always be able to be, but we will have you, it's not going to be a one-sided determination. We're going to have involve the applicant in making that call. The next slide, please. Here is our HIPAA compliant website. And when applicants or potential applicants go on there to register, they are going to be screened ahead of time. There are about 10 questions, I believe, that are going to be asked of applicants to screen them to determine if they are, in fact, potentially eligible for accreditation. And they're going to be your basic questions. For example, U.S. organization, the types of services are utilization of technology, very, very basic. They're probably very simple for you to go through. Next slide. So once you, as I already said, you're determined you're eligible, you paid your fees, then the process begins. And if I hadn't emphasized it, all of these standards applicable to your module, your case use, would need to be addressed. And again, anything that you feel may not apply to you at that moment, I think can be talked through. But really do look at the interpretive guidelines. The committee put a lot of time and effort to very detailed talk through these. And they were drawing from all of our relevant experiences, whether it's their actual experiences as providers, managers, administrators, attorneys, or through clients. We really wanted this to be, we came from various different perspectives. So we all voiced the questions that the guidelines as initially written would raise, and we tried our best to clarify them. So please look at them. We've hoped to anticipate any questions and opportunities for clarification for the standards. And in my opinion, I think they're quite useful. Of course, there may be questions we didn't think of, and that would be where you would reach out to the Institute, which brings me to the next slide. There is going to be customer support available to you. CHQI does have staff members available through the contact numbers shown on the website. Whether that's just using the website, whether it's what how to submit documentation, timing of the reviewer. I'm not sure they can give you an actual guarantee as to timing, but maybe will give you some sense and some help in understanding what the guidelines they mean, maybe talking through the interpretive guidelines. So they are here to help you. And they've also proactively arranged for the workshops and webinars. I think were already mentioned, but they are listed already. They're scheduled, they're planned, and they're listed on the website. The workshops are currently scheduled for, one is May 22nd, just in a few days here in Baltimore, or I am in Baltimore. September 13th in Washington, D.C., and October 7th. I'm not sure where that is, although I can check quickly. I'm not sure, but October 7th would be another in-person workshop. But there also are opportunities for future webinars. One is in June, similar to this, but that will be entitled "Developing a Blueprint for the Future Assessment Evaluation of Telemedicine Quality." So very topic specific, not about the accreditation process itself, but adding to talking about accreditation process and focusing on quality within telemedicine. And in July 18th, very hot topic webinar, utilizing telemedicine and battling the opioid abuse issues. So very good resources available to you. Hope you take advantage of them. Hope you find them useful. Next slide. Okay, so looks like we are at the question and answer session.
Right. This is Rich Backward, your moderator, back again. And thank you, Emily, Kevin, Bill, and Till for the excellent presentations. We're going to transition to a Q&A session now. Please enter your questions into the chat box below the handouts section, which reminds me to mention that the handouts are available for download today. Either the presentation you've just heard or the executive summary of the standards themselves. And what I'd like to do is go into a few questions that have come up, and please ask your questions as well in the chat box, referring to or sending to the organizers and panelists, please. So our first question is addressed to Till, and what should organizations consider when seeking accreditation?
Well, the considerations really mirror many of the considerations for any organization, regardless of whether they're in telemedicine or not. It's very important to realize that we all have an important place in the healthcare ecosystem, and accreditation is really a standard by which healthcare organizations are used to being measured and really recognized as important for quality measures and validation. The organization also needs to really consider very carefully what it does. This gives an opportunity to really step back and think about how you do what you do, but also make sure that the entire organization, whether it be the clinical focus that may be more used to accreditation processes, or the IT and operations groups and others that support the operation, are really committed to accreditation as a marker of quality.
Excellent. And as a follow-up to that, Till, how does the telemedicine accreditation differ from hospital-based accreditations?
Well, there are many things that are the same. I mean, the Joint Commission and other organizations, those of us who've been in the healthcare environment, are very used to that accreditation process. That hospital-based accreditation tends to be very wide-ranging, also focused on patient quality, but also on issues related to safety, emergency procedures, and physician accreditation and other issues that are obviously quite important, that are also important to many telemedicine organizations. This type of accreditation, the CHQI process that we've gone through in the webinar, is really very specifically focused on the evolving process of telemedicine. And while not ignoring the other factors, really very much is focused on the specifics of how telemedicine is practiced and functions in the current environment.
Excellent. Well, thank you. Kevin, moving on to some of the specific clinical questions in the modules, are there any specific requirements for e-prescribing, for example?
Yeah, that's a great question, and one that comes up a lot. In terms of the the general clinical standards in organizations are wondering how deep do you go into what our clinical processes are. And we've talked about the different clinical service lines and different workflows, and really the evaluation is focusing at a higher level on the appropriateness of your processes and procedures for delivering care based on that unique service line. So as that relates to electronic prescribing, those same kinds of perspectives are applied. So with e-prescribing in a telemedicine platform, for example, are you going to be certified for EPCS? Are you going to be providing any controlled substances? And obviously that creates some very unique workflows and challenges on the operational side for monitoring and quality and safety. And separate from that, what are your processes for prescribing? Are you connected to a standard drug database? How is your prescription builder function in terms of the telemedicine platform? How is that medication getting to the patient? How is that documented in the EHR? Are you using a platform that is certified, for example, through SureScripts? And again, what are your quality and safety processes for auditing your e-prescribing processes?
Great. Well, thank you. Follow-on question is, what are some of the requirements for patient triage and referral?
Again, our approach is going to be to focus on, first of all, do you have policies and procedures in place to address appropriate triage and referral? So that's the first step. Do you have those in place? And then as we evaluate further, do you have the appropriate individuals who are making these triage decisions in place? How is that monitored? How is that handoff occurring? How is the handoff being documented? And what are your processes that you have in place for evaluating again, the quality and the efficiency of those processes that are in place? And I think for many of the clinical services, those are some of the real fundamental elements. Do you have a process in place? How do you implement that process? Do you have the right people who are involved in that process? And how do you audit and ensure that those processes are being applied to? And when you audit, what is your quality improvement process?
Excellent. Well, thank you. Emily, before I ask you a question, I wanted to follow up with one of the points that you made in the presentation regarding the workshop. The October 7th workshop will be in Glendale, Arizona, near Phoenix, and that's in conjunction with the SPS conference that's held there annually, just as a follow-up. But the question we have for you is in the case of startup companies, what if they do not have full infrastructure in place to meet all the CHQI requirements?
Yeah, I think that's a good question, and something that we did spend some time on in the committee and going through and really analyzing and focusing in on the standards and how they're going to apply and how they could be demonstrated. And it's not really just startups. It's companies of various shapes and sizes. You can have a company of maybe a handful, 10 or 15 individuals compared to one of 1,500, and seemingly the one of 1,500 would have a bit stronger infrastructure, have their committees, have their policies all queued up, and more easily demonstrated, particularly if they've already gone through accreditation processes, than would be a smaller company that one person may serve in many roles, or a startup company. So I think I'll just answer it in two ways. First, the reviewers, we talked about how they'll recognize the differences of scale. What may be needed for a larger corporation may not necessarily be required for a smaller, and vice versa. There may be some steps in place that may be required on a smaller scale, that not in a larger institution. But for startups, I think this is a good opportunity. We'll apply the same way of analysis to startups. I also think it's a good opportunity for startups to even just reach out to CHQI generally, perhaps for guidance or understanding as to what the expectations are for a telehealth provider. And I think it's a good opportunity to have some support in developing the infrastructure, or just confirming that the direction they're headed is correct. So I think the ultimate answer is CHQI wants to work with providers who meet our jurisdiction, so to speak, our telehealth, those engaged in telehealth services in a licensed and appropriate manner. We want to help them do that correctly, or do it not correctly, but do it in a way that benefits all patients, and we'll work with any type or size to get to that end. So I don't think startups or smaller companies should shy away from this process. I think they should look at it as a good opportunity, understanding that there is willingness on the part of the organization, the institute, to work with them to apply it to their operations.
Well, that's great. It sounds like,
hey, Richard.
Yes, go ahead. Mm-hmm.
Hey, Bill Lewis, I want to make a comment that I think is overarching and applies to both the prior questions, and that is, a degree of, or a principle of reasonableness, in regards to the triage questions that we had earlier, and in regards to this. I think as we went through the process, two things. Number one, we are not setting standards. We are not setting and declaring outcomes. We are not defining the standard of care within an industry. But what we're looking for is that you have the proper policies and procedures, and that you're following your policies and procedures. And I think that's the key part in what Kevin spoke to in terms of the quality component of this. In terms of reasonableness applied to a smaller corporation, again, do you have the resources to do what you say you're doing? We're not going to tell you that you should or shouldn't be doing anything, but if you've got 4 doctors and your claim is you're providing services over 20 states, we're going to, that doesn't seem reasonable to us from a resource capacity and a quality oversight perspective also. So I think the point here is that we're willing to work with any entity, and through a give and take, maybe you downsize your proposal, your request, or upsize it, and/or that you have the policies that are appropriately sized and appropriate for what you say you're doing. And so I think that what we are doing in the certification process, accreditation process, is extremely collaborative in that regard. And some of this, as we all know, it's not black and white. It's gray. And the duty is protect the public and in good faith.
No, Bill, I think that's a great question. And one size doesn't fit all. And I guess as a follow-up to that, what happens for organizations who are accredited but what reporting requirements do they have after they've been accredited during that 2-year period?
Is that for me, Richard?
Oh yeah, I'm sorry, Bill. If you could follow up.
Yeah, sure. Well, I think that's a 2-point question. We expect what you showed us during the initial accreditation to be ongoing. So even if there's no reassessment during that cycle, we will look backwards to assure that you didn't just do a paper audit or paper trail, and that then, say, from a CQI perspective, you didn't do annual chart reviews. And again, to the extent that you say you're going to do them. If you're going to do a 10% audit of your providers annually, we're going to do a random sample of 10% looking retrospectively. If you say you're going to do 5 per provider, whatever the case may be, we will make sure that retrospectively that you've accomplished in the last cycle what you said you were going to accomplish at the initial certification. Now, there also may be scenarios where we define something where let's say it's early days, and to that point, full CQI takes and to get outcomes takes an entire year, right? You identify a problem, you monitor it, you collect data, you analyze it, you put in corrective actions, and so on. So if you're a fairly or earlier entity, you're starting your processes, we may say to you, you're accredited, you're on a good path, we see you're doing it, but we may come back in 3 to 6 months and say, okay, did you complete that audit? What were the results? And did you finally, did you implement changes related to what you found out? So we reserve the right, number one, we reserve the right to re-audit anytime during the 2-year cycle. But specifically, you know, we want to certify you and then see you again in 2 years and then retrospectively audit. But we will, in certain instances, say, here's an area that you're in the process of doing. We think in full faith you're going to achieve it, but we're going to audit during the follow-up 2-year cycle, whether it's 6 months, 3 months, or a year out. So there's some flexibility there that we like to maintain. Then, and God forbid, we retain the right to audit if there's significant complaints or issues or press releases or anything like that, to see if indeed you've deviated from what you presented during the accreditation process.
Excellent. Well, I think we have time for one more question, and that's kind of a general question for Till. What are some of the initial lessons learned from those early adopters who are in the process of being accredited now?
Thank you for that, and it's a good question. I think what we're hearing and what many of us have seen is that the process really defines a set of not standards, but really guidelines and an outline for what one should consider in one's organization. It really provides an opportunity to organize policies, procedures, and rules of the road inside an organization, both for those who are very used to accreditation processes, particularly those who have hospital experience, and those in an organization who may not be focused so much on that, and step back from their day-to-day roles and really look logically and in an organized manner at all the processes that need to be in place to ensure high quality.
Well, thank you. I guess, Lauren, if you can advance the slide one more. Well, I think that concludes the time allotted for today's webinar. We want to thank the presenters for their excellent presentations and responses to questions. And if there are further questions, there are frequently asked questions pages on the website under Telemedicine Accreditation if you'd like to see some of the other questions that have been answered in the past. And if you have further questions, certainly send your questions to info@chqi.com or call in, and we will be happy to respond to those. We thank you for your participation today and have a great day. Bye for now.